welcome back to Care with Candace. So today's video is going to be a little different. It's not going to be really catered to not only my nursing students but also to anyone who's watching who has ever experienced any friends or family who have been in the ICU on a ventilator, okay, a mechanical ventilator. And for those of you that do not know, that is a machine that is into your mouth that is basically breathing air into you and helping you to breathe and keeping your airway open as well. Okay, so understand that there are different reasons why people would be on a mechanical ventilator. Some of the reasons could be acute respiratory distress syndrome, also known as ARDS. Sometimes during COVID, those patients were experiencing ARDS quite a bit. Some other reasons would be like severe COPD. If you have a cold blue where you go into cardiac arrest, they will intubate you at that time. Even with procedures where you're going to go underneath anesthesia, they're going to intubate you during those times as well. Another reason would be an anaphylactic shock or anaphylactic reaction. Basically what that is you got swelling of your lips, swelling of your tongue. Sometimes your airway might swell as well, causing stridor, which is a very high-pitched breathing sound when you breathe in. And the tube is basically able to protect that airway and keep it open so it does not automatically shut. Okay, so understand that when patients go to the ICU while being on a ventilator, there are plenty of different tasks that nurses should be following in order to make sure that that patient is, one, safe while on the ventilator, two, does not stay on for more than 7 days preferably, and three, making sure that the patient is going through CPAP trials and spontaneous breathing trials in order to get off the ventilator if they are able to. The goal is to get a patient off the ventilator if they absolutely do not need to have it. Okay, so I want you guys to know that as family members and as close friends to those who we are seeing in the hospital, we can also play a role without just allowing the nurses to do, their normal everyday task. We can help remind them that your loved one needs to sit up, 90-degree angle at least, so that they can open up their lungs and help to expand themselves. If the person is on sedation medication, where it's basically making them calm, sleepy, drowsy, or anything like that, they are not going to be able to effectively participate in sitting up and being alert enough to take breaths by themselves and without the ventilator actually giving them the most breaths. Okay, another thing is that we can help to remind the nurses is to do oral care. Oral care should be done every 2 hours for ventilated patients. If you walk into a room and you see that your loved one, their mouth is all gooky, it looks very dry, you're starting to see like crusties around their lips and things like that, notify your nurse and ask them to seriously do hygiene care on your loved one. Okay, a lot of bacteria can build up in our mouths. Imagine just on a normal everyday basis, we're eating, we're drinking, we're talking consistently, and now we have a tube in our mouth. It's slightly open, it's getting dried out. You can only imagine how much stuff is being built up in the mouth, and you could possibly aspirate on those things as well. Okay, a lot of people unfortunately do develop pneumonia, which is a lung infection, and we do not want to cause that for our patients. Okay, so those are some things to look out for. You don't want your family member to develop pneumonia, especially while on the ventilator, because pneumonia causes issue with your lungs in order for you to have a limited ability to breathe effectively anyway. So we don't need a tube plus an infection to cause more difficulty and more reason for them to stay on the ventilator. Okay, so when it comes to extubation, there are different criteria for properly extubating through evidence-based practice and stuff that has happened. A lot of times nurses don't necessarily have to worry about that. We leave it to the respiratory therapist. They go through the different weaning trials and stuff, put them on different volume settings in order for the patient to be able to breathe on their own and participate with the extubation process. So the biggest thing is get them off of the sedation medication so that you can follow along with a conversation and be able to follow the commands that you're asking of them. Being able to take that breath when they tell you to take that breath in order for them to deflate the balloon and pull the ET tube out of your mouth. Okay, so just know that if your loved one is on a lot of medications, definitely request that they alter it. They do just one sedation medication and not a multitude of them, because what's going to happen is the longer that they stay on these sedation medications, the more altered they're going to become. Sometimes they can become even combative because they don't know what's going on. The drugs are going up and down, being titrated consistently based off of their behavior, their RAS score, their pain potentially. And if they have all of this medication going in their system for days at a time, it's going to take a while for that stuff to get out their body as well. So immediately when turning that stuff down, definitely be there by your loved one's side so that they have a familiar face, so that they can stay calm and be able to listen to the instructions that are being given to them in order to extubate. Okay, after 14 days, they actually start talking about doing a tracheotomy for patients who aren't able to be extubated. Okay, don't let that be your loved one if obviously the reason for them being intubated is an actual legit reason to be intubated, because they're having difficulties even maintaining oxygenation saturations and stuff. So I'm just talking about patients who are difficult to wean due to behavioral issues when they're in the hospital. I'm talking about those patients who sometimes the nurses can be a little weary about extubating them because they are fearful of what the patient might do because they've experienced the agitation behaviors that they've had. So if the patient is intubated for a valid reason, it got to that point, all other steps of nasal cannula, mid-flow, high flow, and BiPAP have been all exhausted for oxygenation purposes, the intubation should be the absolute last resort. Okay, so do your loved ones a solid favor and share this with them and pay attention and know that there are other alternatives to being able to breathe. Okay, like I said, intubation, if it's not a true respiratory reason, protection of the airway is very important. That is our ABCs of life-saving measures: airway, breathing, and circulation. So definitely make sure that when you do have a loved one in the hospital, make sure that the nurses are keeping up with the turning, the proper posture for when they're on the ventilator, making sure that they're not overly sedated and sleeping so much, making sure that we're encouraging early mobilization. Our body muscles can get very weak after days of just sitting in one position. So it's very important that if we're able to encourage our loved ones to definitely move their upper body, move their lower body as best as possible until they're able to get that tube out of their mouth. Okay, don't ever let the nurses scare you, or the doctors especially scare you and say that if we take this tube out, they're gonna die. I've literally heard that before. Depending on the situation, depending on the scenario, you won't know until you try. But at the same time, it's very important that definite policies and procedures are followed prior to extubating the patient. We just want to make sure that they stay safe at all times. If the person is very erratic while being intubated as well, that could cause a safety issue for the patient, and we don't want them to get injured. So we're gonna make sure that patient is able to listen to us and get that tube out of them. Worst thing that can happen is that we have to re-intubate them, but like I said, there are other steps prior to intubation. It does not have to be that. It can be BiPAP mask, it can be the high flow, it can be the mid flow, it can just be nasal cannula. You might not even need all that extra oxygen in your body. Okay, so like I said, with this video, it's a little different. It's just more of kind of letting you guys know about the different activities to do with the patient when they are intubated in order to kind of speed up that extubation process. If you have a loved one that has gone through this before, or you never know, something, God forbid, may happen to somebody that and they might have to be intubated. So these are just a few key tips and tricks to make sure that your loved one does not end up dependent if they don't need to end up dependent on a ventilator at all. Okay, so like, share, subscribe, leave a comment.